That's better. Thank you very much, everybody, and I want to thank Joe and indeed the rest of the committee for inviting me to speak to you on this topic. I note that I am fourth in an otherwise very distinguished list of speakers, and that my topic is not economics, it's not politics, but I'm glad to see that there's a good representative of people here to hear about it, because I'm going to talk about a quarter of our population, our children under the age of 18. My primary focus in my work is with children and families in Ireland. My full-time job is with Bernardo's Children's Charity, and we support children whose well-being is under threat by working directly with them, their families and their communities, and by campaigning for the rights of children. Bernardo's vision is an Ireland where childhood is valued and all children and young people are cherished equally. So it will be no surprise then to hear, and you'll probably be pleased, that I'm going to just stick to the knitting and focus on the Republic I would like to see for children, young people, their families and communities. I feel obliged, however, to tell you, lest you think that be a comforting thought, that I never actually properly learned to knit. And for women in the audience of a certain age, they'll remember that when we did the Leaving certificate, there was a thing that you had to do separately called a call to training. And you had to do some very fancy stitching, singing and knitting. And what I got for my knitting piece of it was to turn a heel on a sock. I failed dismally. Much, I think, to my delight, although going for teacher training and going into the banks were considered the very best thing that women could do. So, having failed to turn the heel of a sock, I was able to escape to UCG, and I think that was to the benefit of myself, probably to lots of small children that I never had to try and teach to turn the heel of a sock, and so we leave it there. As Joe has mentioned, I'm doing 2 extra jobs at the moment. I'm chairing a HSE inquiry into a specific case in Roscommon, and I'm also with Geoffrey Shannon, child law expert, looking back at the last 10 years and the deaths of children in care, and indeed those known to the social work services, the HSE services. So I'm not going to talk about those 2 cases. Nothing I'm saying should be construed as arising from them, and they're both areas into which I'm not in a position to answer questions. So if I say that in advance, we'll all save ourselves. I'm going to throw some facts and figures at you, and I'll try and make them as interesting as I can. Our population has grown rapidly over the last number of years, and since 2006, it had gone up to 4.25, near enough, million. And that's in the 26-county area since 1861. The census showed that we had the most sustained population growth in that period since the 18th century. 1/4 of our population are under 18. There are more than just over 1 million children and young people under 18 in the country. So it's 1/4 of our citizens. And we have a higher percentage of children under 18 than any other EU member state. But I think if you were looking in from outside, and if you look at the coverage and the opportunities for children and young people to have their voice heard, one mightn't likely see that. I'm just going to take a few trends from a report that Brian Harvey, social researcher, did for us in Bernardo's in 2007-2008, called the Tomorrow's Child Report. And what we were seeking to do was to try and plan forward for the kind of services that children and young people would need, and to see what position should we, as a fairly big one of the 25,000 organisations, the voluntary and community sector that the Minister spoke about this morning, what part should we play with the state and with others and with communities in offering services? How should we tweak what we were doing to meet the needs? So some of them that are important. Adults in Ireland now are becoming parents at a much later age, and the average age for first parenthood is 32 years of age. There are fewer births to teenagers, less than 6%. Again, I think that's a figure that might surprise people, because sometimes the coverage would suggest that it's much greater. There are fewer first-time mothers, older first-time mothers over 40. We've absolutely moved towards the European model of smaller families, 2.84 children per family between 1996 and 2006. And that's a very funny figure, because we know children don't come as 0.84s. Families with more than 3 children now comprise only 15% of households, compared to 40% a generation ago. And a generation before that, families were certainly 14, 12, 11. I myself am one of 11 children, And when I worked in England in statutory social work for many years, people used to be just absolutely amazed. They'd be kind of nearly pointing at me and saying, listen, look what we've met, someone who comes from a family of 11 children. Now there's only 15% of households with more than 3 children. Two-child households is the most prevalent at 36%. Three-child households is stable at 25%. And one-child households is 23%. Regardless of what you might believe, again, from what's reported, over 82% of children live with two parents or guardians, and just over 17% live with a lone parent or guardian. And that includes children being raised by their mums, being raised by their dads or their grandparents, but where there's a lone parent or guardian. Births outside marriage rose from a very low level of 5% in the 1960s to over 30% of births now. Most of the children, as you know, born outside of marriage in the 1960s did not remain with their mums. They were, if they were lucky, placed for adoption, and if they weren't, they joined other children in our industrial school system. There are just over almost 63,000 non-Irish children living in Ireland, and this number had increased by 57% since census 2002. And that posed a great challenge to our education system and to our communities about making space for those children and their families. There are just under 11,000 traveller children in Ireland. That's just over 1% of the total population, but interestingly, they comprise 49% of the total traveller population. Again, when we represent traveller population and community in the media, that's not a fact one would read too often. Divorce was introduced in 1996, and our annual divorce rate has settled in around 4,000 a year. Not the calamity, I think, that might have been thought it was going to be, or proposed that it was going to be when it was introduced. Interestingly, most people whose marriage break down in Ireland tend not to apply for divorce, preferring to remain separated. And in that way, that's an Irish solution, I suppose. We're different from other countries. Leanne Fahey in 2007 pointed out that while all populations go through a number of cycles and trends, changes in Ireland have been unusually rapid in that period of time. One of the most drastic changes in Irish society has been the diversification of family types. There's been a growth in the number of cohabiting couples, a growth in the number of same-sex cohabiting couples, and an increase in the number of these couples who are now raising children. We have never been quick to change either our policy or our law to accommodate the welcome diversification of family life in Ireland. While the recent Civil Partnership Act 2010 is very welcome, it gives no rights to the children being raised by same-sex cohabiting couples, and it fails to provide them with an equal legal relationship for those children to both of their parents. This is yet another challenge that the Irish legal system presents for children who are being raised in families other than the married family, not so much recognised in the Constitution, but the Supreme Court has interpreted the word family in the Constitution to mean the married family, as being worthy of special protection. However, the underlying family patterns in Ireland remain very stable. For example, the traditional family of two parents, never before married, remains the norm in 2/3 of Irish families. The marriage rate is the highest in the EU, and the rate of lone parenthood is stable. So, again, it's better than perhaps sometimes we might think. What hasn't changed very dramatically, and I think does have a bearing on many of the conversations that are being held here this week, is where and how families live. In 1966, the urban and rural population in Ireland was exactly equal. 60% of Ireland's population now live in urban areas across the state. And by 2070, it is estimated that more than half Ireland's population will be living in the Greater Dublin area. These figures, of course, apply to Census 2006 and didn't take into account the high rate of immigration of our young people referred to this morning. This increasing rate of urbanisation, however, means that families are now living in much closer proximity to each other, and the Greater Dublin area, it's estimated, will have a population of 2.5 million in the next 15 years. How this changed environment will meet the needs of children and families remain to be seen, but it's clear that the physical infrastructure needs to be developed and integrated with services and transport development, and that will be crucial to ensuring that safe and appropriate spaces are provided for children to play in and hang out in a way that allows for their development and appropriate autonomy and choice. The Ireland that I grew up in as a child had loads of free places to play, because I lived down the country and the ditches were our favourite play places. Our children are now growing up in a much more confined space. Many of our housing developments, and particularly apartments, have been designed for childless couples and haven't taken the needs of families with children into account at all. And I think we are storing up a number of great problems for ourselves if young people have nowhere that they can go and develop without being under the watchful eye of us parents all of the time. The changes in Irish society have had very many positive outcomes for our children, particularly, I think, the laying aside of some of the it was a very rigid Irish society that I grew up in. I'm delighted that some of that is absolutely gone, although I think we always have to be careful not to throw everything good out. Overall, in all of the studies that have been done across Europe, checking on the well-being of children, and there's lots of well-being indicators developed. Michael McDougall referred to some of them yesterday. However, the flat-screen TV just didn't feature in any of them that I saw. But all the ones that asked children things like, are you happy in your family? Are you happy with your relationships with other children and young people? Mostly, they were happy. So overall, our children are doing well. And we've done some research with children and families all over Ireland, and their enjoy with being with their parents and being with the family is really great and palatable to see. The couple of issues that come up very frequently for them is concern about safety, and that's why they feel less safe. Their parents feel that they're less safe, and we've always got to be careful about handing on our own fears to our children and to young people generally. But I think that's just a feature that came from both the young people and from the parents, and it's why I just wanted to talk a little bit about the kind of developments and what we're building for them. Because of what I do, because I suppose what I've always done, and because of my work in Bernardo's, I am very aware, of course, that there are children and families for whom there is very little that is good in their lives, and for whom, in my view, this Republic has not fulfilled the ideal of cherishing all the children of the nation equally. And it is to those I now turn my attention. All of us heard, in fact we've been hearing it since the 2007 general election, about the different crises Ireland is facing, and the bits of it I've been here for this week I've really enjoyed. So we have four at least: a banking crisis, a fiscal crisis, a real economy crisis and a social crisis. Of course, until the day after the election there was no crisis at all. And then four, a bit like the buses, came along together. Most of the talk I hear every day on some aspect of the crisis are mostly concerned with Ireland's rating by various credit rating agencies, the haircuts applied to NAMA. The first time I ever heard that, I just thought, what? A haircut? You know, I understood one thing about a haircut. I now understand something entirely different. The haircuts applied by NAMA to loans transferring in from the lending institutions. And of course, we're all becoming very familiar with the workings of the commercial court. These various crises are not separate, of course, and they come together in a very real way for Ireland's families and children, particularly those who are experiencing disadvantage. And I'm just going to go off my paper for the moment, because last night when we were looking at solutions and who might get taxed more and who might pay more, I was horrified, annoyed, but not surprised to hear people go back and reach yet again for those who were paid least in our society, to pay for this fiasco that wasn't of their making. And I read today in the Irish Independent that the government is paying an estimated 18 million a year to support its own workers who are forced to rely on social welfare benefits. It's an article by Anne-Marie Walsh. It's a figure that I wouldn't be up to date with these new ones, but we have it now, that some of the families suffering most in this country are children who are in families where parents are working but are in low-paid employment. And they're applying for and are eligible for family income supplement. And the numbers applying and being granted family income supplement, which of course is means tested, has gone up significantly and will continue to rise. In the same paper this morning, I read that of all of the things that the government is going to do to save its £3 billion, that it is to this group of workers they are going to go. So I presume at the end of that, many more of them are going to be eligible for more family income supplement. Sometimes I wonder, does one hand know what the other one is doing? Or do we have coordinated government at all? I really personally can't see the benefit in taking money with one hand and having to give it back in the other to keep families who are working out of poverty. The various crises I've got to there. Now, children, that's my rant over. Children and families in Celtic Ireland, the Celtic Ireland pass by, and there's very little that remains behind for them. The communities that these children are growing up in feel abandoned by our state. The majority of them are living in and around our largest cities and are characterised, their communities, by higher than usual unemployment, very high levels of intergenerational poverty, high levels of both petty and serious crime, high levels of harm from drugs and alcohol, and a lack of services sometimes to meet even basic needs in some instances. Many of those communities are housed in estates that are old, rapidly deteriorating, and where no substantial finance was made available in times of plenty for essential repairs over the years. In 2008, 6.3% of children continued to live in consistent poverty in Ireland. Consistent poverty is not something that the community or NGO sector dreamt up. It is the government's own official measure, and it's the one we use, although there are others that use at risk of poverty and a number of other measures. But I prefer to talk about the government's own measures, their own rates. The consistent poverty is 6.3% among children, 1.7% amongst persons aged 65 to 74, and just 1% among persons aged 75 or over. I don't think it needs to be an either-or situation. I think all of our citizens should be down at 1%, and it should be our aim to eliminate consistent poverty. But when the next figures become available from the next census, we expect, obviously, that the number of children and others living in consistent poverty will have grown, and the reductions that were made in the rate of consistent poverty between 2004 and 2008 to have been lost. What's poverty about? It's not just about a lack of income. It's about your inability to participate in society. And consistent generational poverty exposes children to a higher risk of being exposed to a range of deprivations. And children in families living in consistent poverty over time are often described as both vulnerable and poor. Because everybody who's poor, as you know, if you're poor for a year, you can live with that. It is the grinding poverty over time. And now and again you see some brave soul, either here or in the UK, hopping out to live like the rest of us for a month on social welfare. And they have a really hard time. Well, no, they only manage a week usually. And they get to make a TV documentary about it and get us all excited. If you sent them back for generation after generation to look like that, they might come back with some different attitudes about the dispossessed in our communities. Children living in poverty live in families for whom life is a constant struggle for making ends meet. They experience hardship, living in inadequately heated homes, wearing poor quality or insufficient clothes, and not getting enough nutritious food to eat. Many of those on low incomes, particularly those who are working, cannot afford to take their children to the doctor in time, the dentist or the optician, and they are on long waiting lists in such crucial areas as for children as psychological and psychiatric services. The waiting lists for some of those are 14 to 18 months. That's a long time in a child's life. If a child of 3 or 4, 6 or 7 has a psychological need for assessment, waiting for 18 months is not acceptable. It means that medical conditions are not detected early and can have a very detrimental impact on a child's development. And I think we were all rightly angry 2 weeks ago when an eye surgeon came on the television to explain to us that he couldn't carry out essential eye operations, particularly on small children, and if they were left, that they would go blind. It's a big, big thing to say that in Ireland in 2010 that's happening for some of our children. A particularly disturbing aspect for me is the lack of access to speech and language assessment and treatment. Of all the things we need for our small children, we need those of them who need speech and language therapy to get it very quickly. Why? It's the biggest cause of problems later on. If you can't get communication going for a child, if you can't get their speech and language issues attended to, they go into preschool unable to communicate with their teachers, they go into primary school unable to communicate with their teachers, and you're setting up those children to fail from day one. So here in Ireland in 2010, I'm sorry to have to say that a child's life chance continues to be disproportionately affected by their family's social and economic status, where they were born, and their family's position on Ireland's social ladder limits their potential before they begin in life and greatly hampers their ability to find their own way out of poverty. I was working in the UK when Norman Tebbit did his famous pull up your socks and cycle to find a job. Easier to do that if you have to move, if you're well educated. We're not giving some of our children a chance. One of the clearest ways to counter such inequality is access to education supports, which assist children throughout their educational career. Yet children living with disadvantage in Ireland continue to face stark inequalities of opportunities and outcomes in education. They are much more likely to have difficulties in areas such as literacy and numeracy, to leave school early, and are far less likely to progress to university or other higher education options. And a policy decision that I would have been very much in support of, that took away university fees, did not increase the number of children from working class backgrounds who went to university or other third level education. There could be lots of arguments as to why that didn't happen, but it didn't happen. Literacy levels have remained largely unchanged since 1980, and still today, children in disadvantaged areas, 1 out of every 3 of them, leave our primary schools unable to read and write to a satisfactory level. We have pumped lots of money at different times into that, and these reading scores, again, they're from the Department of Science at the time, now the Department of Education and Skills, a national assessment of English reading in 2004. You might remember that the DESH programme came in with additional supports, and then a lot of people had to fight very hard 2 years ago not to have many of them removed. They did apply to schools that had DESH disadvantage status, but about half of these children are not in schools that have been labelled like that, so the extra supports didn't necessarily come to them. But I look forward to seeing, did those initiatives make any difference to the rate of literacy? Because if you send children away from primary school unable to read and write, and lots of colleagues who did continue in teaching, and particularly in secondary school, talk about the difficulties they have with children, the difficulties the children have coming into secondary school environment, trying to manage, who don't have basic reading and writing and numerical skills. Social inequality is a huge factor in leaving school early. Over 90% of children and young people with parents in professional occupations complete the Leaving Certificate. Just 2/3 of their counterparts from unskilled manual backgrounds do so. Early school leaving continues to be a significant challenge for children living with disadvantage. When the education system fails a child and they leave school early, it affects all aspects of their future life: employment opportunities, child and adult health, and it places them at a much higher risk of involvement in crime. The implications of this place a significant cost on our society through the vision of services and remedial interventions, and it's much more expensive and costly for the economists and politicians to intervene remedially than it is to get in and prevent in the first place. Studies have consistently shown how early intervention and prevention with preschool children and their parents are the most cost-effective interventions and can form a basis for a range of positive effects in young people's lives, including increased school retention, reduced antisocial behaviour, improved job prospects, as well as in reducing criminal activity. The interventions with long-term follow-ups work even best. We know that prevention and early intervention works, so why don't we do it? When I go into government departments to talk to them about possible services, they say, well, show me the evidence, so I bring the evidence. We have the evidence. There's international studies, they're absolutely been done most rigorously, but we're not doing it. Part of the problem is that it doesn't fit into the 4 or 5 year political cycle. And what we want are champions to get this message driven home and to put the investment that is there in the early years. I don't care what gender they are, I don't care if they're old, I don't care if they're young. I want them to take the evidence that is there and to use it to make good investments on my behalf and on your behalf and on behalf of our society, and intervene early and prevent rather than put in remediation later on. It's a crucially important issue that getting out of school early involves young people in crime, almost automatically. They're hanging about, they don't have things to do, and you know, it's the old saying. Young offenders tend to be male and to come from clearly identifiable areas. They have low educational levels, poor parenting supports, and a strong family involvement in crime. 96%, Hayes and O'Reilly did a study, 96% had been suspended from school, compared to 7% in a comparable group from the same background and all of that. So being excluded from school has huge implications. I'm not suggesting that it's easy to deal with children who are disruptive in school at all, but I think we need to think about solutions that doesn't include turning them out on the street, because we are all going to be paying, and they will pay very strong later on. Paula Mahoney did a study on prisoners in Mountjoy in 1996. 80% had left school before the age of 16. Only 7.4% had stayed in school beyond the age of 16. None of them had attended third-level education. We could have an argument about who should be in prison in the first place, particularly in light of recent events, but none of the prisoners had attended any third-level education. 1/3 of the prisoners had never attended school higher than primary school or perhaps special school level, and only 1/4 had ever taken a public examination. Some of those examinations had been completed while in prison. He did some research also in the Children's Court, and it shows that over 80% of children convicted of crimes lived in local authority housing. Many had previous contact with the HSE Psychological Service, and most were out of school, prompting him to conclude that there was compelling evidence of an utterly defective social system. These characteristics have remained over time and are still there in the profile of children appearing before the Children's Court. Children in the care system are even more affected by this, and the risk of such children becoming involved in the criminal justice system are significantly higher, both for reasons related to their own background, but also how they are treated by the state when they come into the care system. 4 in 10 children, that's children under 16 years of age, who are on custodial remand, have a learning disability. They are the children that I talked about who leave our primary schools unable to read and write. We haven't captured their needs, we haven't prevented what is almost inevitable if we don't, and they're in custody, and they have a learning disability. Some of our detention centres, where thankfully now there's fewer youngsters, almost every single one of them has a real issue with literacy. 203, there were 203 in April 2010. There were 203 children and young people in custody in St Patrick's Institution. That's part of the prison system, and young people should just not be there. We have been condemned at international level for having young people in St Patrick's, because if you mix young people who are with crime in with very hardened criminals, you know what you get back. You get back people. Again, I was in England when Willie Whitelaw had his sharp shocks, and they went in maybe having done something. They came out lean and fit and much better able to commit crime with lots of new ideas about what they might do. It just didn't work, and yet I hear it mentioned now and again. It's estimated that it cost us over €92,000 per year per prisoner, and the average cost of a detention centre is over €330,000. And that's from the Irish Prison Service's annual report for 2008. If we were to properly prioritise our children, this kind of spending would be provided for early intervention service models that aim to redress the inequalities in our children and to give all of our children the best start they can, rather than on focusing on interventions that often come too late, not at all, and are designed to fail. Again, I want political champions for early prevention and early intervention. I'll take all comers, age, gender, it makes little difference. I now want to talk to perhaps one of the greatest areas in which we as a nation continue to spectacularly fail our children, our most vulnerable children. Since the publication of the Ryan Report in 2009, Ireland has read many more reports of abuse and neglect. It's shocking that that level of abuse happened in our country. It's shocking that abuse continues. But most shocking for me have been that the reports have indicated that the system, with statutory authority for child protection, is inadequate for the task. And last week, the report on foster care services in 3 Dublin area by the Health Information Quality Assurance Organisation found that not only was this system failing children, but that senior management in the HSE failed to recognise that childcare regulations existed to safeguard and protect vulnerable children. It also found that there were serious deficiencies in the governance of services and a lack of a child-centred culture at management level in particular. What we're talking about here is a failure of management. Many of the management levels that are in the HSE, and I was with the Child Abuse Commission, when the HSE was created, and I knew lots of people in the old health boards, and if there was a problem with a child in an area for which we had responsibility, I knew who to talk to. When I came back, I discovered there was this person, that person, an LHO, a general manager, many of them with no previous experience with children and families. And you nearly have to introduce, say, come here, and by the way, this is a child, and this is what a family looks like, and this is what a family in disadvantage looks like. Our 1991 Childcare Act is almost 20 years old. Before that, we relied on the old 1908 Act for over 80 years. The Child Abuse Guidelines are 11 years old. New guidelines were started to be promised from 2005 onwards, following what we would be told every year was a review of the old ones. They've now, I understand, been shelved. The report of the Ombudsman for Children, Emily Logan, confirmed what we already knew. The guidelines were never fully implemented. The approach was à la carte. Another name for it, I think, is light regulation. It didn't work with our banks. It doesn't work with our children. And I've spoken to the Minister on more than one occasion, and I wouldn't be a lone voice at all. The need to put those regulations on a statutory basis so that there is some comeback for children and families when they are not implemented. In the light of the catalogue of scandals and reports, I suppose we still have to ask, how can this still be happening? I'm not naive enough to think that any system can fully protect all children from abuse. Child abuse occurs in the main within families and within communities. And as such, some types of abuse can be very, very hard to detect. Indeed, I know that most social workers are hard-working professionals who do their very best to ensure that children's needs are put first and come first. And you might say I'm a social worker, and I would say that, but here comes the but. I have concluded for some time that the HSE, as it is presently constructed, the child welfare and protection system, is not fit for purpose. There is a lack of leadership, a lack of clear national standards, a lack of a clear assessment model, and no national agreement on the threshold that we as a nation want to set in respect of protecting our children. Barry Andrews, the Minister for Children, spoke last week after HICWA published the report on foster care, and he was very clear in his condemnation of the HSE management failings. And I would have to say that he has worked hard in many ways to improve things for children in need of protection. He still is of the view that the HSE is the only way to go. Minister, I have to disagree, and he would know that, it wouldn't be news to him. I know the arguments that child welfare and protection services need to work closely together, that communications between disciplines is essential, but the evidence all points in the one direction. And when the evidence is all pointing one way, I think you have to listen to it. The HSE, for the purposes of protecting the welfare and protection of children, is not fit for purpose. It was established at arm's length from the Department of Health, and the cynics would say that was done quite deliberately to keep ministers away from taking responsibility for our health and social services. It has no clear leadership with specific expertise in the area of child welfare and protection. The Minister announced the appointment of a National Director for Child and Family Services that will report directly to the CEO and the Board of the HSE. I welcome that, but unless that person is supported both nationally and regionally, she or he is likely to fail. They are going into a confused and unwieldy system that is much more committed, with some notable exceptions, to protecting itself than to protecting children. I have to say, I have a sense of déjà vu. Many changes to the child protection system were promised under the Rhine implementation plan, and some are being progressed. But whether these changes are enough remains to be seen. I think, along with all the other serious discussions we're having, we want to have a serious discussion about how we should protect both the protection and welfare of our child protection system, and real political leadership to commit to doing just that. If we don't refocus and change, our system will continue to fail children across Ireland. I will refer just very briefly to the referendum on children's rights because Deputy Mary O'Rourke dealt with it yesterday. The debate on this, as we were reminded, started in 1993, and it's gone, as always is the way, into a number of committees. So finally we got one that agreed and came up with the wording, and now every government department is looking at it to see what about it can they find so very wrong so that it doesn't have to happen. The significance of holding a referendum to place children's rights in the Constitution is crucial. And I would just remind us again that children under 18 make up one quarter of our population. The promotion of their rights could be covered by legislation in some cases, or improved practice definitely in legal and service provision spheres. But our Constitution represents the heart of Irish law. And in talking sometimes to our departments, I think I have to remind them that the Constitution fundamentally belongs to the people of Ireland, not to government departments. And that I know there is always an issue about money, and it's important for children that the rights and principles which enjoy express constitutional provision must be protected from interference, and no law or policy can be passed which interferes with them. And in that much I certainly agree with Justice Adrian Hardiman. Children's rights set out in express form in the Constitution will require protection by present and future governments and all state bodies. It would mean, for example, that required express consideration be given to children's rights in all areas. And most importantly for me, it would provide a remedy in the courts to children, their parents and their representatives who seek to challenge the failure to fulfil commitments to children, and would raise the profile of children's issues by putting them onto the political agenda. A constitutional amendment on children's rights isn't just another piece of paper, and I wouldn't be somebody who would suggest that we should, in a willy-nilly way, interfere with our Constitution, although I wouldn't be as conservative as Justice Hardiman appeared to be about it yesterday. If we all took that line, there'd be no Constitution in the first place. But it is a statement of intent and a solid promise that we value our children and we cherish them the same as we do all other citizens. And then rights, of course, if there was an issue, would have to be balanced. That's what happens now for the rest of us. Voice matters for children. It matters for all us ordinary people. And for most ordinary people, the development of public policy has not been well understood. The policy has been handed down, if you like, and there has been poor, very poor accountability across many sectors. And the public, I think, have woken up to a culture of waste, mismanagement and more than occasional corruption. The danger now, I think, is that we could emerge with nothing but a cynical view both of politicians and of politics. And that is not something that I think would be good for us as a nation. We need to encourage people to get more involved in demanding accountability and transparency in public policy and pushing for policies that emerge from a sense of solidarity with each other and, crucially, with those who most need support, but not in the paternalistic ways of the past that has so badly let us down. We need active citizen engagement and we need a new social contract. And I note the remarks by Minister Carey this morning at the proposals to cull the community and voluntary sector who support the voice of the voiceless. And I can only shudder. And I would want to see Minister Carey, who has been crucial in building up some of those voices, in defending voices and in defending that sector. It doesn't mean that I think everything should be left just as it is, or that there mightn't be lots of scope for certainly more accountability there, for cost-saving measures. We're all very realistic about where we are as a country. But if it's a slash and burn type situation, we will go back to where we were, where ordinary people will be expected to keep quiet. The Republic I would like to see to bring lasting social change would be based on social justice and fair treatment for all our citizens. Recently I looked again at the work of John Rawls, his first statement of principle in a theory of justice, where he proposed that each person possesses an inviolability founded on justice, that even the welfare of society as a whole cannot override. For this reason, justice denies that the loss of freedom for some is made right by the greater good shared by others. This resonates with my own life experience, but particularly with my experience working in the Commission to inquire into child abuse, now called the Ryan Commission. I had the privilege of being involved from the beginning and chairing the confidential committee of the Commission from its beginning in 2000 until 2005, and I remained on the Commission until its report was published in 2009. I heard the testimonies of over 800 adults raised in the Irish childcare system from 1913 up to 1917. They were mostly reared by members of the religious orders, although some of them were with foster families. And if you look at Chapter 3, which is the report of the Confidential Committee, you'll see what people told us about foster families. Some of the foster families. Most of the people I had the privilege to listen to had very little formal education, but they were well able to speak their truth, to analyse what had happened to them and why it happened. I learned much from that experience, but overwhelmingly it reaffirmed to me the dangers to the society that is posed when the rights of an individual is sacrificed to what is perceived as the greater good. Some rights that were swept aside include the right of a child to be raised by the single mother or parent, and for all of the children we committed to industrial and reformatory schools, the right of each one of them to be protected from those who would seek to do them harm. I believe that if we guard the right of each person, we will ensure the common good of all. Am I very slow or?
You're a bit over.
Bit over.
But, could you
Could I will. I'll do something. When the report was published in May 2009, and Ireland was very angry, I didn't hear too many voices trying to explain what common good exactly were we serving when we put children in industrial and reformatory schools. Perhaps the truth that it was done to banish children who required extra support of the state to grow up happy and healthy was too painful for our nation to hear and to acknowledge. It could be described as a republic of the good and deserving, shutting out those whose birth or circumstances were less than ideal. That system was started in the 1860s, had some good things then, but it was left to continue. Why? Voices inside were silent, and it was not subject to any outside scrutiny. Let us not let that happen again. I want to just go on to one good example that's happened recently in a community that is described by everybody as disadvantaged, people living in the Dolphin house flats in the South Inner City. There was an innovative advocacy initiative taken that involved the biology department of NUI Maynooth and the local residents. There was a hearing held, chaired by Dr. Maurice Mannion, the President of the Irish Human Rights Commission, who spoke here this morning, and he found that Ireland was in breach of the UN Convention on Economic and Social Rights. What the biology department in NUI Maynooth found was that there was a high level of fungal contamination in the flats, which could prove fatal, which represented a significant threat, firstly, to the health of residents, and which could prove fatal to those with lung disorders. The residents came, they brought their videos of mould on the clothes, mould on their furniture, mould on their walls, curtains. They showed videos of the backflowing sewage forcing the plugs out of their baths and their sinks. That this hearing was held was remarkable, but what was most remarkable was the active commitment and involvement by the residents themselves. This is a demonstration of community activism at work, and it's something I think in my republic I'd like to see more of. It's most positive. Dublin City Council, by the way, committed to working with the residents to find solutions acceptable. But before we get too carried away, there was a slight mention of money being scarce. But this situation didn't develop in the last 2 years. What's really positive is that the action happened, the hearing happened, and there was really a positive contribution into the wider Rialto community by philanthropic organisations, which is building the voice of the community. and we hope for a wave effect that includes increasing the voice of the marginalised, both with Rialto, with Ballymun, with Limerick and with Fatima, to promote similar community. I'm going to skip on again now, because that's all very interesting, but I'll just skip on because I realise I've gone on. My Republic would welcome diversity in a positive and open way. It would honour, respect and cherish the creative energies of all those living in Ireland. It would build up an ethos of solidarity and hope and reject the politics of fear. It would work to have effective services and institutions that work in a way that benefits everyone. In my Republic, the model of community mobilisation would be supported in all disadvantaged areas. Importantly, it would look after its children. In 2007, UNICEF said, "The true measure of a nation's standing is how well it attends to its children, their health, their safety, their material security, their education and socialisation, and their sense of being loved, valued and included in the families and societies into which they were born." In my Republic, that would be up in lights. And I would add in that their rights would be respected and provided for, and that their voices would be heard in all matters that concern them. Thank you very much.